We got the live video, had a little technical issues here. COVID-19, our real talk. This is the first part of our series. Just having a real conversation about COVID-19. So first thing I'm going to do is just talk a little bit about me, just so you know who I am. I am Dr. Brenda Robinson, CEO of the Black Nurses Coalition. I'm also president of the Arbor Hill Neighborhood Association, a proud member of the Albany Public Library Board of Trustees, and the City of Albany Commission on Human Rights Chair. I've been working very hard in the community since the 1980s, and our mission, vision has always been to eliminate healthcare disparities. Tonight, a few of our topics, we got to talk about the impact of COVID-19, healthcare disparities, social determinants of health, comorbid conditions, COVID-19 and my world, testing, and what we can do. Just real talk about it. And I do see that we have the mayor online, Mayor Sheehan, thank you for attending, and also the NAACP president, Mrs. Deborah Johnson. We appreciate you attending, and I also did this presentation previously for the NAACP, and I thank them very much for having me as well. So as we get started, as we look at the underserved communities, which I work in all the time and live in as well, the direct and indirect impacts are there, and I just want to read through a list just so we can have this in mind as we go forward with this conversation. And some of these impacts, which we all have felt in some way, death, illness, fear, grief, unemployment, fear of being laid off, depression, anxiety, increased stress, homelessness, hopelessness, helplessness, insecurity, racism, discrimination, lack of trust, misinformation, inability to provide for one's family, anger, increased violence, increased arguments at home, increased hoarding, lack of education and resources for many of our children, and lack of resources, period. So I'm having a little difficulty with Zoom, so I'm going back and forth on live, just in case you're wondering what's going on with that. So those are just a few direct and indirect impact of COVID-19. Now, we first heard about, I just want to bring everybody up, and I know a lot of people are on different levels when it comes to the coronavirus and COVID-19. I just want to make sure everyone is on the same page. And I just heard this recently when coronavirus first came out, when they first started talking about that, novel coronavirus, that is, folks started saying, coronavirus is not new, I've heard of that, it's not new, it's even on the Lysol cans, this, it's a bunch of lies, blah, 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 and it would go on in regards to this virus. So I just want to clear it up just a little. Coronaviruses are a large family of viruses, commonly found in species such as animals, such as camels, cattle, cats, and bats. So when you look at that can and you see coronavirus, just remember it's a family of coronaviruses, okay? So far, prior to this, we saw two coronaviruses, the MERS coronavirus and the SARS coronavirus. And I know you guys probably remember SARS. So those are two viruses, right? Then came along the third, SARS-CoV-2. And this is the virus that brings about the disease novel coronavirus. And they're abbreviated as COVID-19. So we have the CO for corona, the VI for virus, and the D for disease. And the 2019 is there representing when they first started speaking about it or really identifying this new strain of the coronavirus. Okay? So we just all want to be on the same page with that. So maybe not new, but it's a new strain. Okay? So as we go forward with the discussion about COVID-19, some of the other things that I hear a lot is the discrepancy, confusion, or whatever you want to call it in regards to COVID-19 and where it came from, the origin. We hear about the outbreak of Wuhan, China. We've heard many different things and many different concerns. Many researchers and scientists are looking at the different ways possibly that this coronavirus came about, right? We even heard about a lab in North Carolina that also worked with the lab in Wuhan, China. We also heard many conversations about the United States also funding some of this research. So we have a lot of different folks, I think, really working on that in the origin part. For me, and for you, what we know for sure, regardless to what we believe, whether it's manufactured, whether it's intentional, whether it's unintentional, whether it's the labs in China, or the labs in North Carolina, or if it's warfare, or if it's genocide, the fact remains that COVID-19 is here and we are dying. There's no discrepancy in that. So we really have to recognize that regardless of what you believe, whatever propaganda, whatever, what we do know is that we are dying. Right? So when we continue to talk about COVID-19, there's numerous unknowns, and we have to admit to that and embrace that as we go forward. Even the transmission. You know the possible ways of transmission, person to person, or contact with infected surfaces or objects, and then we touch our eyes, mouth, nose, right? So with the rate of infection, we also know that there must be other ways that this transmission is happening. And of course, we have receptors all over our body, as far as receptors for viruses, bacteria, disease, period. So transmission is also unknown. Everyone's learning as they go along. That's why we have so many researchers and scientists on TV now really giving input in studying COVID-19. Even the date of COVID-19 when it came on the scene, right? We have folks who have did autopsies of folks earlier from 2019 who now we see tested positive for COVID-19. And these are folks who weren't even travelers. They had some folks who they did autopsies on who from California, they weren't even travelers. So you can't say they went, out of the country and that's how they contracted COVID-19. So there's a lot of unknowns. Also, we hear about the symptoms, the flu symptoms, the sore throats, the headaches, these regular symptoms that we hear, right? But it's also other symptoms as well, such as the blood clots. We don't hear much about folks talking about blood clots and amputations and different signs and symptoms that folks are going through. But it's not just a sore throat and a fever that people are having. So you hear all different types of stories where or accounts of different symptoms people may have. When we look at the unknowns as we continue with that, just recently, if you watch the news today, you heard about the young folks, like 85 people, young people, children, school age, in New York State with the new illness. Of course, they gave it a name, pediatric multi-system inflammatory syndrome, fever, rash, abdominal pain, inflamed blood vessels. They don't know. It's the unknown. We're in unknown territory. Thank God that we do have researchers and scientists, but a lot of things are unknown and we really don't have experts. We have experts in epidemiology, experts on viruses and all these different things, but to say we have an expert on COVID-19, no, they're learning as we go along. But at the same time, though, basic science, proven science remains the same, so we do have that foundation to work from. But COVID-19 seems to be very elusive to a lot of people. And like I said, we are dying, right? And we know that black people and brown people are dying at an alarming rate. So as we talk about COVID-19 and the devastation in the complete United States and the world, we can't talk about that in the disproportionate impact that it has on black and brown people. We can't talk about that unless we talk about healthcare disparities. Anybody who knows me know I talk about healthcare disparities all the time. And for those of you who don't, healthcare disparity, what is it? Healthcare disparity is a large burden of a disease, injury, death carried by one group, basically the black, brown, and beige people and poor people. But what we must know, and I think many of us do know, but we need to recognize and acknowledge that minorities have the worst outcome of just about any disease that you can think of. So COVID-19 devastating people that look like me is no surprise. It is absolutely no surprise, and it shouldn't be a surprise to a lot of other people either. So we have to acknowledge that. We have to face these healthcare disparities, right? So a good thing that Cuomo did, he's doing great leading this particular pandemic. The New York State Department of Health was one of the first dashboards that I saw that was up that really looked at the demographics, such as race, because that's very important. So outside of New York City, and I noticed when you look at New York State, they tend to separate New York City because it's so large and it can skew so many different things. So outside of New York City, and we know New York City has had a hard time, New York State fatality rate for black people is 18%. 18%. But we only make up 9% of the state. When we look at Hispanic people, right? Fatality rate is 15% and they only make 12%. So if I'm telling you that the fatality rate of black people is 18% and I know we only make up 9%, that's a huge disparity. That should let you know something's going on. Something's not right. It's just not adding up. Right? Of course. So healthcare disparities are not new. Right? The CDC in 2018, they reported the black to white disparity in heart disease death rates increased 16.3% from 1968 to 2015. In 2015, heart disease death rates were 21% higher among black people compared to white people. Those are healthcare disparities. This is ongoing. It's not new. Breast cancer. Why is it that someone that looks like me gets breast cancer less than a white person, yet I die at a higher rate? That's a healthcare disparity. These are things that we have to acknowledge and look at and work on. Because COVID-19, that devastation is not new. We're getting devastated day in and day out. It's not new. These disparities are not new. The exposure to this issue is new. And we must hold on to that and work on that, right? So as we talk about healthcare disparities, you certainly can't talk about that without having a conversation about the social determinants of health. And I'm quite sure many of you hear that a lot, and I mentioned this when I was speaking at the NAACP, is oftentimes I ask folks, do you know what a social determinant of health is? People say, no, I don't know what it is. I don't know what it is. I'm like, yeah, you do. I'm like, yeah, I do. I'm like, yeah. Have you ever had a situation where you couldn't afford food? Have you ever had a situation where you lived in substandard housing? Have you ever had a situation where you worked very hard, even 2 jobs, and you still were at the poverty level? Have you ever lived in a place in a neighborhood where you couldn't even find fresh fruits and vegetables? All that social determinants of health. We know what that is. You may not know the fancy term, but many of us have lived it. Unemployment, poverty, substandard housing, food insecurities, racism, discrimination, whether systemic, institutionalized, whatever cute name you want, racism, discrimination, lack of access to health care, and all those folks at the front line. And going back just 1 second to lack of access to health care, I just want you guys to know, a brick and mortar building with a sign out in front saying health care and another sign says open does not mean health care for black, brown, and beige folks. So let's not get that twisted, right? This is real talk. This is real talk. So we have the healthcare disparities, social determinants of health. Then we move to the comorbid conditions. Do you know what it is? Comorbid condition, an underlying condition. conditions, 2 or more conditions present in a patient at the same time. These conditions give us a higher risk of COVID-19, such as diabetes and hypertension. I'm quite sure you guys have heard that. These comorbid conditions make us a higher risk, right? All right, so we have the social determinants of health, very difficult, bringing about healthcare disparities. Now we have these healthcare disparities. Now we have comorbid condition due to all the factors of social determinants of health and healthcare disparities. So therefore we have this hypertension and diabetes. So now we have the comorbid condition brings us susceptible to what? COVID-19. So now we have COVID-19. What are we going to do? We're going to seek care, seek help, or whatever we can do in regards to that. And what do we run into when we go get help? Social determinants of health. We right back at these social determinants of health. And what's that going to breed again? Healthcare disparity. A vicious cycle that we need to come together and break. And black people like me, black people like you, other people on this call who help with the cause, they've heard this over and over again, but now we need to take action and work together and do something in regards to healthcare disparities, because COVID-19 is real, people. It's real. Regardless of what you believe about other things, COVID-19 is real. So before I go a little bit further, I just want to tell you a little bit about my world, because I do realize everyone really don't live in the same world, especially not the same world that I live in. Your situations are different. I live in Arbor Hill, love living in Arbor Hill, proud to live in Albany, New York. That's me, born and raised right here. But my world, when I get out and work every day, whether I'm working my regular job, whether I'm working in the community for the Black Nurses Coalition, my world includes majority minorities, low-income folks, the uninsured, folks with low health literacy, educational barriers, the elderly, as well as many who only fit some, all, or none of the above. I serve people who have money and those who don't. But one thing I would like to say, rich and black, poor and black, still suffer from the same biases and stereotypes in healthcare. And we must recognize that. So that's my world. A few more issues in my world: education, trust, the media, numerous injustices, confusing leadership, untrustworthy leadership, lack of transparency, false information, racism, overt or otherwise, mental health, increased substance abuse, beliefs such as COVID-19 being created by the government, and so on. This is real talk and real issues. This is what's going on in my world that folks are concerned about. In my world, it's a lack of trust. Beliefs such as COVID-19 being created by the government. It's a lack of trust. We're already a population that does not trust government and leadership, and rightly so. You know medical apartheid. I'm quite sure you know about the Tuskegee experiment, forced sterilization of minorities and black women back in the 60s, which was upheld by the Medicaid department. Unequal treatment, which was identified by the Institute of Medicine. This stuff is not new, and so on, and so on. So that lack of trust is valid. It's not that, we don't trust just because. No, our history dictates so. When we watch TV about New York City and different places, you watching TV, so what about those mass graves I just saw on TV? Is that too by design? It makes you, yes, you question everything. You have the lack of trust. And what else do you have? You have fear. People in my world are fearful. You have to recognize that. Fear of the establishment, fear of the government, fear of dying, fear of losing a loved one, fear of not being able to survive. Fear impacts us mentally and physically. And fear goes hand in hand with trust. We look at fear, we look at trust, all those things. And then in my world, we have stress. And I have basically just one sentence for the stress piece, because you know why? Black people carry the heaviest burden of stress, period. Period. That sums up everything when it comes to the conversation about stress. So we're going to keep all that in mind, right? We're going to keep all that in mind with this real talk. And now we're going to move and talk about just a little bit about testing. Because as we go on with this series, I want everyone to be on the same page. We're going to talk a little bit about testing. And testing is so important. We need data and we need testing. So there are two types of testing, just so that we're all on the same page here. We got the molecular and the serological, right? This testing. All right, molecular. You guys probably may think you don't know what it is, but you do. The first type of testing is used by the WHO and the CDC. It's even used here. It's a nasal swab. Right? The nasal swab, like a Q-tip, but it's about 6 inches long. They insert it in each nair, about 15 seconds each. They take that Q-tip, right? Put it in a tube, send it to the lab, right? A few days, you get your results. What that Q-tip is doing is looking for genetic material, like that RNA. You heard of RNA and DNA. It's looking for that RNA of the SARS-CoV-2, which is COVID-19. All right? And that has proven to be pretty reasonable and accurate. Then we have the serological test. When you hear that word, you automatically going to think of blood. So it's either a prick or an actual blood draw for this particular test, right? And what they're looking for antibodies. Our bodies develop antibodies when we're exposed to a virus or a foreign invader. So that's what they're looking for. That's why you hear a lot of people talking about the antibody test. The problem with antibody tests is that they're highly inaccurate. And there's so many people working on all different types of tests, the rapid tests, all these different things, right? But the problem is that these tests, the accuracy, the validity, the false positives, the false negatives, are just unreliable at this particular point. So I know some folks see on TV, oh, they're going to do the antibody test. They're going to do the antibody test. I want it. Okay, folks. We got to have a good talk here, because you're going to see a lot of things on TV, right? You're going to see a lot of things like Dr. Gupta. You see him on CNN all the time. He wouldn't have the antibody test, right? His came out negative, right? Then they talked to him afterwards. And they had a conversation about how unreliable it is, the false positives, the false negatives, and so on about the antibody test. So I do understand that we have to start from somewhere, but we have to realize and acknowledge the inaccuracies of that test. And I'm talking to our little group here, our big group here, who most certainly look like me. I'm hearing over and over that you're watching TV, you see these things, somebody mentioned antibody test, somebody mentioned this, somebody mentioned that, or whatever. You, me. Well, you should recognize and realize experiments, and this is an experiment, experiments have not been good to black and brown people. So we have to acknowledge that. Experiments are necessary, but make sure you do your homework and know what time it is before you run up there raising your hand, wanting to volunteer for something or say you want something when you don't even know what you're even asking for. All right? We have a responsibility, too, to be informed. You're not excused from being informed, and just watching CNN is not always just the way to go. You have to use other resources as well. And again, along with testing, we do need more testing. And I believe the testing that we have now, the nasal swab test, the genetic test, I think needs to have the screening removed. Testing should be for everyone if you want it. Because it makes no sense to have the screening where you have to have symptoms, right? You have to have all these things, yet you know there's plenty of times where people don't have symptoms and they get COVID-19. So why do I have to have a symptom to get tested when it's really striking people down that look like me, but I call to get a test to make that appointment the way I should, but I can't get tested because I don't meet the criteria? Yes, I do. I really do meet the criteria. So I think that really needs to be addressed. Even watching TV today with the tenant in the White House there, they were speaking about the 2 positive cases that they had in the White House and the social distancing and things like that. And then I hear they get tested every day, although they're using the Abbott rapid testing is one of them that they're used, which is a lot of times inaccurate. But at the same time, these, the White House staff and other high-profile people are getting these tests. So, we have to be careful that we don't wind up with a disparity when it comes to testing. Because whenever that happens, who gets the worst end of the stick? It's us. People who look like me. The black, brown, beige people, and the poor people. We always get the worst end of the stick, and we have to acknowledge that. So then we look at treatments and vaccines, right? And I know you heard the tenant in the White House as well when the hydroxychloroquine came out in the Z-Pack, and it's gonna be great. It's gonna be great. Well, some folks ran out. They knew their friends who had this particular medication. Like if you're on lupus, they may have that particular medication. Took the medication, had all these complications. Listening to someone who by now you should know better. Okay, by now, it's been years now. You should know better. Then we have antivirals that they're working on. None promising yet, but I heard a report yesterday about the Remdesivir. Yeah, that's the Ebola drug, the antiviral, and they're doing trials with that. But hopefully soon we have an antiviral that certainly will work. That's what research is about, and we'll see how it goes. Then we have the conversation about the vaccines, right? And you hear leaders say, 1 to 18 months, we're going to have a vaccine. 1 to 18 months, we're going to have a vaccine. I'm just reading some of these comments. 1 to 18 months, we're going to have a vaccine, right? All right, so we had, as I mentioned earlier, the SARS coronavirus, right? That came around 2002, and it disappeared around 2004, right? So we had the SARS. Then we had the MERS coronavirus. Came around 2012, and it still hits us every so often with outbreaks, right? So now, okay, we had the SARS 2002, MERS 2012. Yet to this day, we don't have a vaccine for either of those coronaviruses. We don't have a vaccine yet for any of those two. But for this deadly COVID-19 that we can't get a handle on, we're going to have one in that 1 to 18 months? Yeah, right. We better get some plans together and some precautions in the event that we don't have a vaccine. Okay? And our experts, they were unprepared. Even with the CDC, when back in April 18th, when they had the issue at the lab where they said that they had sloppy lab practices, and the first specimens that they had to throw them out because CDC didn't follow protocol. Well, CDC created the protocol. So again, experts have been caught off guard and unprepared. The federal government wasn't prepared. And we hear all these forecasts, right? Forecasts, these models, all these different things that we have here. But we have to remember these are just forecasts. They're hypothetical. We can have some of our own hypothetical things, right? But hopefully they're based on a little bit of science, but at the same time, it's still hypothetical. But we still need to follow the science and the facts in those who follow the science and the facts. Don't continue to listen to someone who half time don't even believe the sun is shining when it really is. If you know someone really gives poor advice, someone is just openly, I would say, openly racist, openly just shown in every which way that they only caring about themselves, be careful of accepting the advice that they give you. That person mentions to you about injecting yourself with disinfectant or whatever. You don't go run out and do that. This person makes that comment, and then the calls to the Poison Control Center just goes crazy. Because some people are following some of that bad information. We have to be careful. Be careful what you listen to. Then we have the myths out there. Not just, some things are blatant lies. Some things are just intentional and on purpose. Some people just don't want us here. But we're here. We ain't going nowhere. We're here. some myth that we had, right? I was watching TV the other day, and in fact, when I was on the NAACP call, a young lady had the question about Neosporin, right? And it was a video put out by a comedian, and he was saying putting Neosporin on your nares and it would prevent COVID-19. Well, for one, Neosporin is for bacteria, and COVID-19 is a virus. Two different things, all right? So antibiotic does not work on a virus. If that's the case, when you came in with a cold or whatever, that's why we don't want you to get antibiotics, because they don't work. Any type of virus, it doesn't work. So science is still real. Science is still true. A virus and a bacteria are still two different things. So even though a lot of us are dying, please use some of that common sense that you know to be true, because some of that common sense still remains to be fact. So be careful what you're listening to. On that same thing, that particular comedian, right? He was in his kitchen. I know some people on this call right now actually sent me the video. This comedian was in his kitchen, right? He's going to all these different cabinets, pulling out all this stuff. He said, in the morning, I take this. And he pulled out about 4 or 5 things, right? I'm like, oh, okay, that's what he used. And I'm like, all right, I'm most certainly going to have to look into this for the people. You know, he's a comedian I like. Then I'm watching him. Then he went in another part of the kitchen and pulled out a whole bunch of other stuff. I'm like, you doing that every morning? Oh, yeah, I do this every morning. Then he proceeded to another cabinet, pulling out a whole bunch of stuff. For one, there's no way that I could afford that unless I was rich like him. For two, I just don't believe every morning you spending your time taking all this stuff and doing all these things. That just be your whole day. I know we social distancing, I hope. I know we staying at home, but I'm not going to spend my time at home with about 50 different herbs and pills and all this other stuff. That was just ridiculous. And who can afford it? So we have to use common sense. And I know common sense is not always common, but you better get you some, okay? Because this is life or death that we're talking about, okay? So when we start talking about a little bit about, Governor Cuomo started talking about looking to reopen and the different pros and cons about that. And they spoke about tracing and testing, right? And tracing, when a person actually tests positive, and we're going to trace and find out everywhere they went and trace their steps and all the other stuff or whatever, I think it's a good thing to a certain extent. When I watch China or wherever other places were where they have their cell phone, and wherever they go, they got to scan their cell phone before they can get in or out of place or whatever. Now my antennas went up, because I don't want to see that here. We have to remember where we are. We have to remember about our human rights. We have to remember how hard we fought for civil rights. Now I know it's COVID-19, right? And I know a lot of us are dying. But we still have to remain vigilant due to unintended consequences and intended consequences. We're not just going to throw our civil rights away and our human rights away, due to COVID. We still have to be vigilant. You have to know your history, because you don't know your history. You know what they say, you're doomed to repeat it, right? And we ain't always had a sweet time here in the U.S. We love the U.S., but it hasn't always had a sweet time, right? So we have to be vigilant when they start talking about all these different things. Someone called me earlier today and said, oh, did you know about the mandatory vaccinations and the mandatory vaccines? Well, first of all, we don't even have a vaccine yet. But we have to stay vigilant. We start talking about mandatory this and mandatory that. Even with the tracing that they had over in China or Korea, wherever it was. What about the folks? Now, I see these people, their nice pocketbooks, everything going up to the place with their cell phone. A lot of them had the iPhones or whatever. What about folks who don't even have a cell phone? Come on now. So be vigilant. So when you listen to stuff, when you listen to these policies, when you're listening to Governor Cuomo, when you listen to all these things, right? Be vigilant as well. Yes, we want to save everybody. I don't want to see anybody die. I don't care what color you are. I don't want nobody dying, right? And at the same time, I know people are trying and doing their best, but you're not going to just run over my civil rights and my human rights while you're doing it. So we have to be careful, because once it's taken away, you got to fight like hell to get it back. So be vigilant. One of the other things that I've recognized too is statistics. We all, as a people, right? We have to be more aware of statistics and what we listen to, right? All right, now I just told you earlier about New York State fatality rate for black people is 18%. Some people I can say, oh, the fatality rate is 18%. They say, oh, wow, oh. Well, why are you doing all that? Because it's the first thing you need to ask me, and you need to know, well, what is the rate of black people in New York State? You don't know the rate, 18% means nothing. So once you know the rate is 9%, then you can say, wow, what a huge disparity, blah, blah, blah. We have to know basic statistics when we're listening to all these different numbers, all this different information. We want data, right? But we have to be able to analyze the data. And we also have to be vigilant, because sometimes when other people analyze data for us, it's not accurate. So we are responsible as well. So when we say other people are accountable, and I do hold people accountable, but you got to hold yourself accountable as well. If I say 12, if there were 12 deaths, right, out of 1 million people, that's one thing. But 12 people dying out of 100 people, two huge different things, and we have to pay attention to that. I know when I was in school, I wasn't crazy about statistics, but these numbers are life and death numbers, you know? And also Albany County, right? We now have a dashboard as well. And I don't know if you checked it lately, but when you get a chance, please check the Albany County dashboard. I believe our deaths for African Americans, black people, are at 20.3%. And hello, we only make up 11.4% of Albany County. Okay? Have to pay attention, folks. Have to pay attention. There's a lot of conversation I hear when I visit folks in regards to reopening, right? My second home, Atlanta, Georgia, with their reopening, and I listened to Mayor Keisha Bottoms as it being an experiment. We all know that. It's an experiment, whether you want to be part of the experiment or not. And then we have 83% hospitalized in Georgia are black. You know, this is across the board. We have to pay attention. We have to be vigilant. 47 states to partially reopen. Reopening, I believe that we will see a resurgence, an increase, a spike in cases and death. The death of not just black people, death across the board. But we know we're going to get hit the hardest. You got to think about these things when you're listening to the reopenings and the different phases and all the different things that they're speaking about in regards to reopening. So with all that information, right, as we sit down and talk, when we think about the impact, right? When we talked about those impacts, you want to think about, well, you know, what can we do? We as a people. What can we do? First of all, folks, we need to take this seriously, because this is serious. This is not a fly-by-night little cold that we have. You know, you look at so many people dying, it's almost just unbelievable. But we have to take this serious, and we have to be accountable for ourselves just as we're accountable for the next person. Precautions, you know that, the hand washing and not touching your face, the hand sanitizer, disinfecting the surfaces, wearing masks. Come on now, the social distancing, the 6 feet, these things are important. We're not playing a game here. Lives are being lost. Don't wait till it's your brother. Don't wait till it's your sister. Don't wait till it's you or your child. Come on, let's take this serious, because this is serious. This is a matter of life and death. Black and brown people are dying at an alarming rate. Just watch your TV. What else can we do? We want a seat at the table, right? We stop asking, we start demanding. Come on now. We might have to bring our own chair to the table. In fact, we might have to bring our own table and chairs. I don't know, but I know we got to do something different because healthcare disparities is not new. This has been ongoing. We have leaders that's been here, and in order to make an impact on something that is devastating a particular group of people, such as we are, the black people, the brown people, the minorities, the poor people, you have to have these folks at the table and have them a part of that discussion. And as we go forward, we haven't been a part of that. And that's why these healthcare disparities just continue. But I'm on my job. I'm doing my job. And we have to do more than talk. Some of us talk to the cows come home. Or what you going to do while you laying on your couch or whatever. And that's fine. But sometimes, can you please just close your mouth and support somebody who is doing? How about that? That's a difference. Try doing that. Because oftentimes that is what we see in our community. Some of the other things that we can do, we can ask for data. Because we do need more data. We need to do a drill down. And I know Governor Cuomo did mention that he was going to do more of a drill down as far as people who test positive, what occupation did they have, all these different things. These things are very important and we need to know these things. Right? We need to be an active participant. We need to read and stay informed. We need to be aware of the propaganda. We have to be socially responsible, people. Wear your mask. If you're not wearing it for yourself, wear it for your grandmother. Wear it for your child. Come on now. We need to monitor funding. And this is real talk. This is just real talk. We have to monitor funding. When things like this happen, all this funding flow in or whatever, and it's under the guise of the minority neighborhoods, the poor neighborhoods, and the funding just goes, I don't know where it goes. I don't necessarily see it. So we certainly have to monitor the funding, especially when it comes to federal funding. We got to make sure that, especially the city of Albany, the county of Albany, we have to make sure that we get covered as well. Right? And I need you all to join me in holding folks accountable, including ourselves. So when I say hold folks accountable, I'm talking about, we're going to speak about voting. Yeah, I want you all to vote, right? But vote for those who support you and support your community. Get informed. A lot of us go vote and you don't even know where these people stand on anything. You don't know what they did in the last 4 years or the last 2 years. You have to be informed because we have to make a change. This is an ongoing situation. Use common sense. Right? If you don't have common sense, get some. All right? Common sense is very important. Matter of fact, a lot of us can get through a lot of things just by using common sense. And the other thing that we can do as well is as we go through this trying time and all this loss, let's not forget ongoing injustices, right? Like Ahmaud Arbery, that murder, so many different things. Because sometimes I think when we're going through a pandemic and things are so terrible, a lot of things get swept under the rug or we don't pay attention to it. But all that's a cycle and everything impacts everything. So we have to stay vigilant, people. We have to stay vigilant. And support those who are supporting you. It may not look like you, but if they supporting you and you guys can come together on the same path, get that support. And if you can't, act. If you can't, act. Your vote is important. What you do is important. COVID-19, I just listened to so many different stories, so many tears. It's sometimes it's overwhelming. To knock on the door and you listen to this little old lady who, one young person over here can be just so devastated and fearful and crying. You go see the 85-year-old and she just bouncing all around saying just how she worried about us. She's not worried about herself. She's worried about us. So you have so many different emotions. You have so much fear. But I think a large part for us, especially black and brown people, that trust is a big issue. It is a big issue. And we're going to have to deal with that. And we also, like I said, we're going to have to take our seat at the table. I'm working on an initiative now because we need to do what we need to do for us. When we constantly ask, sometimes you got to wake up and say, hey, I got to get to work. I got a job to do. And we all have a job to do. And we need to do it together. Right? So I'm very happy that you tuned in for part 1 of our Real Talk series, because it's definitely real talk. And I just wanted to make sure that I thanked everyone for tuning in before I get to the Q&A, right? And before I go, and I got an interesting Q&A. But before I go to the Q&A, I did want to mention that Mayor Kathy Sheehan is having a town hall meeting Wednesday at 7 p.m. And I'll be one of the panelists on there as well. And also Assemblyman John McDonald on Thursday at 11 a.m. He's having a webinar as well. And I want to make sure you guys tune in. Now for this Q&A, because I had an interesting Q&A. Is that a question? What are the? I had some interesting questions that came my way. One question I had was, should I wipe off my groceries when I bring them in the house, right? That was a pretty good question. I know a few people do ask that or whatever. For me, it depends on what you're getting, right? I do wash vegetables and different things more than I used to. Brought a watermelon yesterday, and I had that all bubbled up and scrubbed all down, and it was, oh my God, it was so nice and shiny. But far as if you bring in, I know a lady who she brings everything. She wipes down her cereal boxes and all the other stuff or whatever. That's gonna make you feel more comfortable. Then you go do that. I don't wipe down everything. Vegetables, of course, things that are exposed, of course, but you always wipe down top of your canned goods, stuff like that. But the extra, as far as the boxes, no, I'm not doing that. Unless if I see a box doesn't look right, I'm throwing it in the trash. Not doing the wiping really, but you know, that's kind of up to you. What about folks who refuse to wear masks? I get this question all the time, right? Hey, I'm a keeper. I get this question all the time about folks who refuse to wear a mask, and I see it a lot. Even when I go in my office, sometimes I sit look out the window. I'm like, didn't I just give him a mask about an hour ago? What the heck is wrong with him? And sometimes I find it to be very frustrating. Sometimes I would sit there and say, I'm not even going to give him another mask, and I get a little pissed off sometimes. But before I know it, I'm right back out there talking to him, saying, you know, the reason why you need to have this mask on. Do you know that COVID-19 is real? So I go right back out there and do my best to encourage. And I would say to you, when you run into folks who refuse to wear masks, who just seem so non-compliant, we also got to remember that it's fear, because fear make you feel, okay, well, if I don't give into it, that means that it's not true. Well, that's fear. So still, don't give up on a person. Please do not give up on a person. Continue to talk to that person. Continue to encourage that person. Please do that, because I think eventually, or maybe you can make an impact with that person or the person next to them. So I think that is very important as well. Can I take a walk? Yeah, you can take a walk. I mean, if you live in a place where you come out your door and there's 50 people right outside your door or whatever, you know, I would be very cautious. I would certainly wear a mask. I would certainly try to get to a place where it's less populated. I'm not going to be in a group. We know that by now. We don't want to be in a big group. But yeah, go take a walk. I know some folks go to Thatcher Park. I know me, I can go right in my yard. I mean, yeah, you need to get out and get some air. This pause does not mean that you're not going to go outside. You already go outside if you need to go to Walmart to get, you know, and get something. So fresh air is very important. If, someone asked if they had COVID-19, can they get it again? Yes, you can. So even if you test positive for antibodies, that does not mean that you're immune. So immunity is evasive, so we don't know anything about that. So if you had COVID-19, please don't think that you can't get it again. Righties, would you recommend folks getting tested? So if you had COVID-19 COVID-19, yes, you can get it again. Someone asked me about the New York State pause being extended. The pause still expires, May 15th? The extension was for the state of emergency. That extension that they gave us for June was for the state of emergency. So it's kind of two different things. And I was listening to Governor Cuomo. He was mentioning about unpausing some of the parts of New York State who meet his criteria, some regions and some not. So the pause expires, but the state of emergency is extended to June. All right, so we have to be a little clear on that, because I was listening to him today, and I can't wait to find out what is the decision going to be as far as opening up some things. But he has his criteria, what he's going to have, and how he's going to roll that out. But pause does expire. All right. Should I take off my shoes in the house? For me, that's not a question, because I don't wear shoes in the house anyway. I haven't worn shoes in my house in about 30-something years. That's not what we do, but some people do. This is why we got to realize, like, some of these questions, some of the information, what may not apply to me may apply to somebody else. So if you do wear shoes in your house, please stop. Okay? Please stop. If you wear shoes in your house, make a change. Stop wearing them in your house. This is a good time to stop. All right? You're going to keep everybody safe. You know you're walking out there. Who knows what you're walking in? And especially if you're a healthcare professional, take that stuff off at the door. You don't know what you're carrying. Right? I was told nurses aren't even being reported because we get reported for what? I don't understand.
The COVID cases or COVID deaths. The COVID cases and the COVID deaths.
Explain that a little bit more there. All right, so got another question. This came from my cousin, Miss Sweet Sylvia. She had a question about dating and dating safely, right? All right, so if you got a partner and you sleep with your partner every night, whatever, I don't see why that's going to change with COVID-19. I do know if the person tests positive, then of course that person's going to have to self-isolate. My thing just going. That person is going to have to self-isolate if that person, of course, gets, test positive or come up with symptoms. We know that. And this is real talk, right? Unless you, when it comes to the dating thing, this is if you have a partner already. You have your husband or whatever, you live in or whatever you call the person or whatever. I don't think that's going to change. Unless you don't want to sleep with the person, and then you can use that as an excuse. Hey, COVID-19, nah, get away from me. Read it. Cuomo said, or whatever you want to do. If you're sick of them, then that's the way out. But if you sleep with this person every night and this is your person, and thank you ATL for signing in. If this is your partner, then it's going to be business as usual as far as your bedroom. But if somebody gets sick, if somebody has symptoms, then that changes the game plan. Now, a single person trying to date, you're going to have a hard time. For one, I guess you can do the video chats like people can do and do all the other stuff or whatever. But that dating thing, somebody new, it's risky. But if you like taking risks, wouldn't advise it. Sorry, you probably should have got you a partner early on to go through this with, because it's risky out here. Someone asked me a question about the dentist, and one person was mad because the dentist had put off all the cases and stuff like that. One thing when you're dealing with dentists, though, is when they work in your mouth or whatever, it's the aerosols, right? So that's risky with the aerosols and the viruses. So it's not like the dentists don't want to get your money. It's not like they don't want to do their job. But those aerosols, very important, okay? And even though they use PPE, the personal protective equipment, is very hard to really protect a person, right? So they have to be careful as well. They want to be safe and they want you to be safe. Then we talk about, the viruses suspended in the air. And I know my cousin was saying, it stays in the air all these different days and whatever. But you got to remember as well, when we talk about that 6 feet, 6 feet should be enough distance for people. If you're talking to someone and you have saliva coming out your mouth, right? As some people do, That aerosol also has saliva, so it's not as light, and it has the weight, and it's gonna fall down. It's not gonna stay suspended as though you did an aerosol test. I sprayed the aerosol and it stayed in the air for so long. Yeah, that's a test. But for regular folks who speak, then you're going to have saliva and other things. It's not going to float in the air like that. You know that back in the days you used to say it, don't spray it. Yeah, well, it's that spray. And hopefully being 6 feet from that person, that's enough distance for it really not to reach you. But also, if you have your mask, that's even better, right? Let's see. Gloves. I had a question about gloves. And the question, well, actually the person made a statement that they could not get enough gloves, right? Well, some people don't need gloves until they learn how to use gloves, all right? Some of you folks, some of you might be on this Facebook Live putting they wear one pair of gloves all day. That's why sometimes I don't even give people gloves, because it's just ridiculous. Common sense, people. One pair of gloves all day. You hop out your car at Walmart. You put your mask on. You go get your cart. You're in Walmart, right? You pulling this down, pulling that down, or whatever. You in your gloves. You so safe. Pulling all stuff down. Still with your little dirty cart. Rolling around. Well, Walmart been cleaning the carts. But you walking around with your cart, right? With your gloves. You get all your stuff, you put it up there, whatever. You go in your wallet. Same gloves. Go in your wallet. Pull the stuff out, right? Getting your money. You're getting your card or whatever you're going to do. You pay for your stuff. You're going out there. You might stop and try to get a coffee or something like that. The same gloves. You get to your car. You open up the dirty trunk. You get your, with your keys. You put the stuff back there. You close it with your same gloves. But you're so safe, right? You go get in your car. You're sitting in your steering wheel. Just putting your germs all over the place, people. Some of you still have the gloves until you get home. Oh, I'll just keep these on so when I bring the groceries in the house. This is real talk. This is real people doing these things. Real talk. Gloves. Some of you don't need gloves. Some of you just need to wash your hands and use your hand sanitizer, right? I want to bar some of you people from using gloves because you're making the situation worse. Sometimes I hate to see people coming. You didn't have them gloves on for about 3 days. Now, no. That's not how it works. These are disposable gloves. Now, you should know better. Common sense. Saw a girl walking down the street, right? In my area. You got the kids. You got the gloves. You was eating ice cream cone. Touching everything. And what was that about? If I had time, I would have had to pull over and educate this person. Come on now. This glove thing is getting ridiculous, okay? It might just be better if you just don't use the gloves, if you don't know what you're doing, and just wash your hands. Please, people, because you're making the situation worse. You're making it worse. Then, we speak about people of color, black folks. We like chicken. You know what happened with Tyson, right? So, that Tyson chicken, and they had refused to close with all those cases that they had. And I was listening to a report where the representative was saying that, they didn't listen, but they knew that it was only a matter of time before most of their staff would be able to show up from Tyson plant. And that's what happened. That's why they wound up closing. You got to listen to these type of things that's going on. I was vegan for about, 20 years. I now eat chicken. I wanted some chicken. I went to ShopRite, and all ShopRite had was a whole bunch of Tyson chicken. I said, oh, I'm good. I'm good. So please pay attention to what's going on. The real stories, not the propaganda, not what you heard. Listen, right? Listen intently. Be vigilant. Listen for the facts. What is this? Right? I'm just reading this other question. When testing becomes available with folks who don't have symptoms, I think that's a good thing. Like I said, I don't think that we should have this screening process when at the rate that black people are dying, that people are dying, period. All races are dying. We should not have the screening. If I feel I want a test, I should be able to get a test. I don't think I should be able to get a test every day, but I at least should be able to get a test. I think that's just ridiculous that I got to call on the phone and go through all this hoopla, and then the next day I can barely get off the couch, wishing and praying, oh, but now I can get a test because I can barely move right now. I'm probably headed for vent care or something like that. So I do think that was a good question the person just gave in regards to the testing. I think we should have an option, just as other people are able to have an option. Some person just wrote disinfectant wipes in their car. Good, because we got to stay vigilant, people. Other person said, when do I think is a good time for estimated time for kids to return to school? No time soon. That's my estimate. No time soon, because people don't have their act together. When they get their act together, and I can feel that I can safely say that these young people are going to be safe. Right now, it's not safe. I want to hear some plans. I want to hear some plans about young people going back to school, and plans where, you know, we're at the table as well. I want to hear what these plans are. You're just not going to wake up and say, okay, well, tomorrow's the deadline, they're going back. No. You show me your plan. Show me how you're going to keep these people safe, these young people safe, and then maybe we can start talking about an estimated time of kids going back to school. But it's not today, tomorrow either. I don't foresee that right now because we don't have a plan. We need to just monitor symptoms. Yep, I think monitoring symptoms is a great thing to do as well. But, you know, people are dying who didn't initially have symptoms as well. And then when we look at Albany, I think on the dashboard, I think we were at 12 deaths for African Americans. I think that was the last dashboard on the Albany County dashboard. We were at 12. What about, yes, as I mentioned earlier about homelessness has been an ongoing issue, and I saw a nice commercial about the homeless. Nice in the way that it reflected some things that people don't often think about. It was about the young people who are homeless. And the caption was saying, the young African-American boy was walking around saying, yeah, they tell us to wash our hands for 20 seconds. Well, what if you don't have a home? What if you don't have a sink? And what if you don't have any soap? How does these things help me? And they did a couple of nice commercials about the homeless and the trials and tribulations that they have. And that is something that has to be addressed, most certainly. Even when you talk about New York City cleaning those trains and getting all those homeless folks off the trains, I think we can put more of an effort in for our homeless population. Of the 12 death, I can tell you this about comorbidities, and for New York State, right? At least about 90% of the people, the black people, the fatalities, right, in New York State has comorbidities. And the highest one, I believe, when I read it, was hypertension. And then came diabetes. And then came dyslipidemia, which is high cholesterol. So, yes, these comorbidities are real, folks. So if you have hypertension, you have diabetes, that's a double whammy already. Okay? You got any more questions over there? I want to thank my assistant, Ms. Jare Gauls, and Ms. Fredasia Gauls for assisting me. I was told by nurses some aren't being reported because we get I just have a comment now where someone said that they were told by nurses that some cases are not being reported due to state funding. I believe that the number of death that are reported are underestimation. I do believe that there are more fatalities than what we see. I truly believe that. Killing us, it's a comorbidity. Now, nothing that's common results. There's a someone just put a comment about the belief of what is actually killing us, and that She was mentioning about the comorbidities is what's killing. Well, comorbidities are killing us. Healthcare disparities been here forever. So we got thousands of people die from heart disease every day, black people. So this is one of the things that I'm saying to everyone. Healthcare disparities, these deaths are not new. But COVID-19 has just shed a light on healthcare disparities. Germs on your cell phone. I do think you need to wipe off your cell phones. A lot of times we overlook it, but wiping off your cell phones with a disinfectant wipe, I think is a good thing and very important. What is it? Somebody said, what good is a test when we can be exposed to something tomorrow without even knowing? Right? We can walk out the door any day and be exposed to something without even knowing. We don't know what's behind that corner, unfortunately. And I mean, we're in a tough time now. I think we have to try to work with what we have. I don't think we should just sit and do nothing. That's not a good thing. One person sent me a video about a doctor who was talking about our immune system and how our immune system works. And yeah, that's facts, that's science. And when you're a young baby and the germs and help you build up antibodies, that's great. That doesn't mean that we're just not going to do anything with this COVID-19, because I know how our immune system works, especially as a child. Does that mean that I'm going to continue to mingle with everyone and not realize that COVID-19 is contagious? No, I'm not. Does that mean that I'm not going to wipe off surfaces in the event that my 2-year-old grandson, that's going to prevent him from building up his antibodies? No, I'm wiping this stuff down. That's what we do. That's what's going to be done. This is a different time. This is serious out here. And Miss Bev was mentioning about healthcare disparities, and of course asthma is one of them as well, and not just children and adults as well. So our healthcare disparities are real, and I want to thank you. To start with something, yes, I want to thank you all for signing in and checking in with this real talk. Part 1. I certainly will be back with a part 2. Please remember that we're going to have a town hall. The mayor is having a town hall on Wednesday at 7 p.m. Please chime in. I thank her for putting that together. I thank the NAACP for the forum the other day. And Assemblyman John McDonald will be doing something on Thursday at 11 o'clock as well. So thank you all. Thank you. And next time we have our live and our Zoom working right. Okay? Thank you so much. I appreciate you all. Get right. Social responsibility. Let's get it right. Love you guys.